And a new internal report from the CDC warns the Delta variant is spreading much faster than previously thought. The report, first obtained by the Washington Post, cites new data showing the Delta variant spreads like the chicken pox, much faster than the common cold. Meanwhile, the CDC is set to release the data behind its new recommendation for even those fully vaccinated to wear masks indoors in high transmission areas. This week, the U.S. recorded its highest daily case number in more than 5 months, more than 86,000. That's higher than any single day last summer. Here's Alex Perez.
A startling new report revealing just how urgent the fight is against the Delta variant. In a CDC document obtained by the Washington Post, health experts sounding the alarm, calling on officials to, quote, acknowledge the war has changed. Warning the Delta variant is more transmissible than the common cold and as transmissible as chickenpox, and that it's possible some vaccinated people may be able to transmit it as easily as those who are unvaccinated.
This is an incredibly contagious version of the virus. It's almost like a whole different virus. And CDC is estimating that it is probably also more deadly.
The CDC has not confirmed this report to ABC News. They are set to release the data today that led to its new recommendation that even fully vaccinated people wear masks indoors in areas of substantial or high transmission. As concerns grow over the increasing number of cases across the country and more worries about breakthrough cases, Chicago's largest music festival, Lollapalooza, now underway. Proof of a COVID vaccine or a negative test needed to get in. Unvaccinated guests asked to stay masked.
I got vaccinated. I made sure the people that I'm with are vaccinated. I'm going to have a mask with me.
And Diane, there is some encouraging news. The vaccination rate is inching upward slowly. About 2.7 million people were vaccinated over the last week. Here at Lollapalooza, organizers say just about 90% of attendees had the correct medical documents yesterday, but they say about 600 people were turned away for not having the right documents with them. Diane?
All right, Alex Perez for us in Chicago. Thanks, Alex. And I want to bring in ABC News medical contributor and chief innovation officer at Boston Children's Hospital, Dr. John Brownstein, for more on this. Dr. Brownstein, thanks for joining us. What do you make of these unreleased CDC report saying the Delta variant is way more transmissible than the common cold, instead as contagious as the chicken pox?
Yeah, I mean, Dan, we've talked about pieces of this information, but not, all of this data together. In some cases, the unreleased report has brand new data, and it's a bit worse than I expected. Of course, we've been talking about the Delta being more infectious, now comparing it to the chickenpox and potentially more than Ebola or the common cold. But there's some additional data points, right? The period of infectivity could be longer, potentially 18 days rather than 13 days. That might raise concerns about quarantine and isolation. We saw data points around vaccine efficacy. We've sort of danced around this, but it looks like Delta is driving efficacy downwards, but still doing well against serious illness, which is great. But there's that lower efficacy in our vulnerable populations, the ones that have immunocompromised conditions. And that, begs a question about boosters. And then there's this other headline about seriousness of Delta. There's been a few studies in the UK and India that point to this. CDC is now potentially taking a stance that this variant is more deadly. So again, all of this combined creates a real concern that, what we need to do right now to control this virus is a lot more than what we've been doing in the past few months.
So the report also says that it's possible some vaccinated people may transmit the virus just as easily as someone who's unvaccinated?
Yeah, so this is a real confusing one, and what they're finding, and we're going to see more data about this later today. It's coming out. CDC is going to put it in its MMWR report, but they were finding equal viral loads in noses and mouths of people with breakthrough infections, similar to unvaccinated populations, and so that creates a worry around breakthrough cases and their ability to spread. We should keep emphasizing the fact that these vaccines do work against preventing severe illness, but they may not be working as well to prevent symptomatic disease, which means, again, that you could spread this virus to your unvaccinated populations that are at greater risk. And so CDC is now emphasizing in this document that you just need an even more aggressive vaccination strategy. And it's great to see those numbers starting to tick up, because that is how we're going to get out of this. But, this is a real challenge because you have breakthrough cases. And so that's going to challenge people's perception of the vaccine, right? We're trying to get more people immunized as they're seeing breakthrough cases. It's a really complicated communication strategy right now.
Now, the CDC is also expected to release data today that led to their new recommendation for fully vaccinated people to wear masks indoors in highly transmissible areas. Now that we're learning just how easily this variant spreads, do you expect we're going to see even tighter guidance going forward?
I think that's what's going to happen. We talk about the fact that we have to be nuanced and flexible in guidance as this virus moves around and changes. And, a lot of people are going to look at this like backtracking, but it's really not about backtracking. There's no absolutes. We have to adapt as that virus evolves. And, scientists are still learning about the Delta variant. But, what it seems like is that masking may be super important. Yes, I think it's more likely about masking in hotspots rather than universal masking. I don't think that's a realistic policy right now. But I think, increasing our interventions around social distancing and mask wearing in hotspots are going to be the way to do this in addition to vaccination. And I do think there's a bit of a concern about CDC right now in terms of having made these recommendations ahead of data. What we want to see is data, then recommendations. And so they're going to have a challenge in sort of communicating the science in addition to policies going forward.
So it's believed one of the deciding factors for the CDC in updating this masking guidance is linked to that big outbreak in Provincetown, Massachusetts. 882 people are now infected. 74% of them were fully vaccinated. And I hesitate to even ask this, but should Americans consider canceling or postponing their travel plans at this point?
Yeah, I know. I'm dreading this question because I think we honestly had the same question a year ago. And what's unfortunate is a year ago, we had about the same number of cases. We're just about over 60,000 cases a day. That's where we were last year. And so, that's a concern. I would say, CDC still says you can travel if you're fully vaccinated. I believe that. If you're unvaccinated, I would really consider, not traveling, of course. And you may, of course, consider, masking and testing, ahead of travel. So I wouldn't quite be canceling those travel plans right now, but I would consider getting travel insurance because, things are evolving. We're seeing changes, and I don't expect any lockdowns or travel bans, but some places, especially if you're traveling internationally, may be more challenging for you to get to because right now, the U.S. is a hotspot for this virus.
And Florida Governor Ron DeSantis said just a few minutes ago that he will sign an executive order allowing parents to make decisions for their own children on whether or not their kids will wear masks. So this would overturn any school mask mandate. And he also says his own kids will not be wearing masks. What are your thoughts on this?
Well, I'm concerned about any blanket policy that prevents public health from trying to do its job. Of course, we don't think that the virus is as severe in kids, but many kids are going to get sick, especially with the surge in Delta, and many kids will get severely ill, and unfortunately some will die. And we want all the tools to be able to control spread. And if you're in a hotspot, masking does make sense for kids and, and the teachers themselves that might be vulnerable. And so, of course we can, we want parents to make the right decisions for their kids, but we want school districts to be able to make the right decisions for the kids as well and to stay open. And, if the primary concern is keeping kids in person and learning, masking across student populations will keep them in person and prevent any outbreaks. So I really hope that, we can bring more nuance and flexibility as opposed to sort of outright preventing our ability to control this virus, especially among our vulnerable children who have not yet, had the vaccine.
All right, Dr. John Brownstein, we appreciate the analysis as always. Thank you.
Thank you so much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.